We all deserve to practice safer sex in a way that is comfortable and affirming to us.
Sometimes we need that reminder.
Especially when we experience barriers to navigating sexual health services and resources.
In this video, we'll be deconstructing cis/heteronormative rules and myths
pertaining to sex, sexuality, and sexual health,
as well as discussing safer sex practices for 2SLGBTQIA+ folks.
Did you ever sit through a lesson in health class on contraception or sexually transmitted and bloodborne infections
and leave with more questions than you had when you entered?
Or feel like it didn't really help you?
There are lots of ways that queer and trans folks are impacted by the way sexual health information is shared
and what is excluded.
Despite what our health classes tell us, there are many sexual acts and activities that fall under the umbrella of sex and intimacy.
Not just penetrative sex involving specific body parts.
Oral sex, anal sex, using hands or toys, making out, cuddling, grinding, and humping all count as sexual acts.
And there are lots of ways we can practice safer sex for all of this.
When educators and healthcare professionals make assumptions about sexuality and sexual activity,
not only do we not receive the information we need to maintain our sexual health,
but it can also be mentally and emotionally taxing.
So how can we maintain our sexual health when we feel excluded from sexual health care systems?
Understand that safer sex isn't just about condoms and birth control.
It's about feeling safe and affirmed and knowing all the options available to you.
It's also about harm reduction.
Determine your own individual risk of pregnancy and STIs.
Know if you can get someone pregnant, become pregnant, or contract STIs through your sexual activity.
Use specific language when talking about sex with healthcare professionals to minimize their risk of assumption.
The focus should be on the body parts and fluids involved, not identity.
Communicate openly with partners about sexual health.
Talk about STI status, getting tested, and what safer sex methods you like to use and what you're already using.
Get connected with 2SLGBTQIA+ community organizations.
They might be able to help you find sexual health services that are more welcoming, supportive, and affirming, and provide you with the information you need.
Trans and non-binary folks might struggle to find relevant and affirming sexual health information,
especially when it comes to medical transitions and hormones.
Some hormonal birth control methods can have side effects that trigger gender dysphoria or be affected by HRT.
Some barrier methods can trigger feelings of gender dysphoria
by drawing attention to parts of our bodies that cause us discomfort or stress.
Communication with a healthcare professional
is key to finding options that best suits your needs.
When using barrier methods such as dental dams, finger cots, and latex barriers,
consider using lube to decrease the risk of STI transmission by reducing friction.
You may also want to take pre-exposure prophylaxis, or PrEP, to prevent HIV transmission.
We can't talk about safer sex without talking about consent.
Consent is the most important part of any sexual encounter.
Remember, it is always informed, ongoing, and reversible.
Consent is required for all sexual acts and in the use of safer sex methods.
If someone says they will use a condom, dental dam, or other barrier, and then they don't,
that is not consent.
Be clear and firm when discussing your required or preferred safer sex practices with your partner or partners.
Negotiate safety and the acceptable levels of risk for all people involved.
What will make you feel safe and protected.
In our next video, we'll be talking more about
consent,
communication,
and disclosure of identities in sexual relationships and encounters,
and how we can prioritize our comfort and safety,
as well as that of our partners,
when approaching these interactions.